Hello, everyone. This is Peter from the Peter Vivas podcast. And upon releasing the Josie Maria interview, it was a complete disaster relative to my ignorance about anorexia nervosa. However, I do appreciate having Josie Maria on the podcast, and it really shows how beautiful of a person she is. And rest in peace. It's unfortunate that the events occurred. However, I learned a lot from the experience, and I wanted to bring a psychologist on the show. Her name is Dr. Amy Boyers, and I have an interview here that you're going to be looking at. And Dr. Amy Boyers is a clinical psychologist. She's a psychologist here in Miami, and she focuses on women's health, eating disorders, anxiety, mood disorders, and behavioral medicine. So she has many programs here in Miami. She's co-authored numerous books. She's appeared on television and written various articles on psychology journals. That being said, this has been a great interview with her. It's very boilerplate basics, but I hope it does something. I'm sure it will do something to spread more awareness to these horrible mental illnesses and eating disorders, and for people to have a little bit more care. And I hope you enjoy this interview with Dr. Amy Boyers. Okay, I just want to start off this episode by saying that I'm just a dude who ran into anorexia nervosa through Josie Maria, and I wanted to get more information, understand how the mental illness affects people, and just be more educated on it. And, the wonderful psychologist, Dr. Amy Boyers, we want to preface a disclaimer that this is just purely just simple introductory knowledge.
Correct. This is a conversation based on your experience having met this person. And I'm going to do my best to answer your questions about anorexia and eating disorders generally. But we have to acknowledge that there's no way to cover the entire subject of eating disorders in one podcast, or to get into all of the individual experiences that people have with their own eating disorders. So when we talk today, because of time constraints, I'm talking in very general terms, and I understand that individuals' experiences with their eating disorders may have looked or felt very different than what we're going to talk about today. So this is really just about providing some general information to reduce stigma, and provide some increased awareness and understanding to hopefully help people open their hearts and their minds to understand what people who have eating disorders go through.
We're recording now. All right, so today I have Dr. Amy Boyers on the show. Amy, thank you so much for joining me on my podcast and talking about mental illnesses like anorexia.
You're welcome. Thank you for having me.
Absolutely. Recently I did have a guest on the show who passed away from anorexia, and it was a shocking revelation or shocking piece of news, because I didn't know that these mental illnesses could actually affect someone so harshly to the point of death. And, just to start things off, what, from a professional perspective, Dr. Boyers, what is anorexia?
Okay. Well, I first want to go back to your comment about the guest that you had on your show who died from anorexia. It's important to note that that eating disorders are the deadliest of all the mental health conditions, and account for more days in the hospital. They're second to schizophrenia. So having an eating disorder has a lot of medical implications, and they are very, very dangerous. And people do die from them. Fortunately, they don't die all the time, but they can, and they do. And you unfortunately met somebody who succumbed to her illness.
And it's not necessarily from the mental illness, it's from the actions that are the outcomes of, like, say, for example, not eating,
Correct.
malnutrition, or schizophrenia,
Right.
Maybe believing that you should crash your car into the side of a pole or something horrendous, God forbid.
Well, schizophrenia, I think, is more often suicide. And so, right. So in terms of the way you're describing it, right. So they would probably die more directly from the mental illness itself.
Mm-hmm.
Whereas with an eating disorder, it is often the malnutrition. That's the case in the anorexia. In other forms of eating disorders, there is also a higher rate of suicide, especially for people with long-term chronic eating disorders. It's a hard way to live, and it takes a lot from you. And so there is a higher rate of suicide in this population as well.
And who does anorexia and mental illnesses like anorexia affect? And is it something that is developed, or is it something you're born with? What is that? Is it like, is it a death sentence, or is it something that can
No,
be helped?
definitely not a death sentence. And I think if one thing that people get from this conversation is that recovery is possible, but you got to get yourself into treatment, and you got to get yourself into treatment with the right people. But what we know about eating disorders is that it's a combination of factors, that people are born with perhaps a genetic predisposition to developing this kind of mental disorder. Eating disorders, they typically develop in females, but that's not to be that men don't get them. We live in a culture, particularly in Miami, that idealizes beauty and thinness. And if you grow up in a place like that, or you grow up in a family like that, that will interact with whatever genetic predispositions you may have to developing this kind of a mental disorder. So this is definitely a nature and a nurture situation. And the experiences that we have in the home and outside of the home and online and in social media, all of these play a part. But to say that one thing causes an eating disorder would be an oversimplification. They're complex, and it really is a perfect storm where different factors have to come together all at the same time. And there's also a developmental piece that we often see eating disorders develop at developmental turning points. So into high school, out of high school, into college, out of college. I've even seen them as someone's getting married or about to have a baby. So when there are these developmental milestones where someone's taking a big step forward, or the expectation is that they're going to take a big step forward into adulthood, that can be challenging for some people for a variety of reasons, and the eating disorder will pop up at that time.
And it's almost like it comes from a distressful moment, or a signs of distress, or how you said, a developmental change, a big change, and then these are like ways to kind of cope with that in a sense.
Yes. So that's one of the things that's ironic about the eating disorder, is that as dysfunctional and as dangerous as it may be, it also can be viewed in a sort of warped way as a coping mechanism, that when a person doesn't have other ways of expressing their problems or expressing their feelings, they may turn to food or controlling their weight as a way of self-soothing. And so it's one of these strategies that I often say to people, it's a good short-term strategy, bad long-term strategy. So in the short run, it gives you some relief, may give you a feeling of control over things, may make you feel special. It may lead you to believe that you're going to be more popular because you're going to be more attractive to other people. So it leads you to feel like it's doing something for you in the moment, but in the long run, obviously, it creates more problems than it solves.
And so you mentioned earlier that the environment has a big effect, like social media, or being in a place in Miami where there's people in bathing suits all the time, and people want attention. And that being said, how are some healthy ways to kind of combat this kind of mental illness, or make someone feel like they are doing or basic fulfilling that need in a sense? It just seems like it's such a tough challenge to face, because if you're constantly have these triggering moments in a sense that provoke you to do the actions that, say, anorexia would provoke one to do, like i.e. not eating, what are some alternative methods in a sense? Is it just psychiatry, or do you have to seek medical help? Is it something you could deal with by yourself?
One thing I say to people all the time is we really don't know any other way to treat eating disorders than through the mental health route.
Mhm.
So it depends on, I think, how severe, how long it's been going on. I think the question you just asked has a lot of layers to it. Um, in terms of combating the messages, I mean, there's a lot there in terms of educating young people about how the images that they're seeing online, including images posted by their friends, are manipulated, that people only post certain things that make their lives look amazing and where they think they look their most attractive. We know that the images online are manipulated and photoshopped. And so teaching children that what you're seeing isn't really real, is a big part of it. And we know that social media is much more problematic for young girls than it is for young boys. And that, that probably has to do with how females are kind of made psychologically, where they are very, very attuned to what's going on with their peers, and are very prone to feeling left out. And girls do that to one another, and they purposely will post things online to make other people feel left out. So, so there's a lot to do with the way females interact with one another and the way teenagers interact with one another that has been exaggerated and on social media. So I think a lot of the worst features of adolescent interactions and adolescent social relationships has been amplified by social media and what goes on online and the access to information that they have now.
So you're saying it's like a psychological flex in a sense, like a psychological way of feeling superior over others and making other people feel inferior through social media. That you said this game that at least the female mind tends to play more than the males. I think males do that. I think more on the money side. I'm not sure with the body and things like that,
Not
but
as a teenager, not so much as the money stuff. I think guys do it more with sports.
sports. Okay.
Right. And
True.
actually teenage boys, there seems to be something a little protective about the use of video games. As much as parents hate it,
Right.
they're interacting with one another. And especially now during the pandemic, when there's limited contact, to be able to engage in some kind of competitive activity while being connected to your peers, it does seem that boys seem to fare better with that. If we're being very gender stereotypical, I know there are girls that like video games, and I know that there are boys that are negatively influenced by social media. That's not to say it's an all or nothing proposition, but we're speaking in very, very general terms. But this is really just a piece of the puzzle of one of the factors that
Right.
contributes to the development of the eating disorder.
And you mentioned that there really should be, or education of this mental illness specifically. I've actually been told through my YouTube comments, wonderful people coming on here trying to educate me, and have done somewhat of that. And that's why I wanted to call you to kind of ask more questions. That it's actually called anorexia nervosa, and that there are so many misconceptions about the mental illness. Because when I did the interview back in like May of 2019, I didn't know anything about anorexia nervosa, so to speak, and all of the things that could trigger somebody to lead themselves into harsh actions. And I'm tend to wonder, aside from the fact that this is, I think it definitely requires more education for people to understand that this is an actual problem for people, not just a fad, not just a way to get attention. Like I remember,
Right. You're just obsessed with looking good or being thinner. Right.
yeah,
I think that's a lot of the misconception, that this is someone who's just taken a diet too far, that it's for very shallow, vain reasons. And that's really,
it's
I'm
belittling.
not gonna, yeah, it's really diminishing the significance of what's going on. This is a real psychiatric condition that people die from. And if they could stop doing it, they would.
And how much does trauma, like past trauma, play into this?
High rate of trauma in people with eating disorders, not just anorexia, bulimia, binge eating disorder, high rate of trauma, for sure.
So it might be maybe if somebody who was overweight at a younger age and might have been picked on later on in life, they might steer toward. Is that like something that might happen, or is that too general?
That can happen. I mean, they could be picked on in school, or they could be picked on in their own family. I mean,
Mm.
right? In either case, that's traumatic. But a lot of sexual trauma, physical trauma as well.
And Yeah, there's so many. It just seems as though, like, at least when I was growing up in high school, and even throughout college, there's kind of an oblivious nature to this, because it's, if you're experiencing the mental illness, you're not necessarily so adept to want to even talk about it or even try, let alone to educate other people on it. And it kind of is the responsibility of doctors like yourself, and I think people who can be empathetic toward this mental illness, to let other people be aware, because it could just make things worse. I mean, I was told many times in the comments, I was just saying things, just having a conversation, and that I would say things that would make the so say, for example, I noticed that she looked very thin. She was very bony in her arms or
Right.
something, and that
Yeah,
is
she was
considered like,
visibly underweight in that
yeah,
interview.
yeah, very visibly. And I mentioned that, and I got a lot of comments, a lot of negative comments, saying that, like, that is a triggering thing to say to somebody who has anorexia nervosa.
Right.
And even let alone talking about food. But where's the in between when you're discussing things? Let's say you're eager to learn, a little bit more educated, but where is the in between for when you're talking to somebody with this mental illness? Is it like, I'm not going to say, I don't want to say walking on eggshells, because that is a little bit belittling, but more of a cautious way of having the conversation? Because I could see someone, let's say like a father or a friend or someone who doesn't understand this, trying to help, trying to understand, but actually making it worse by talking about it, in a sense.
It's hard. It's hard because parents and friends, we're not given a manual to tell us how do you approach somebody who has an eating disorder, right? And
Yeah.
I think the question you ask, there's a lot of nuance to it, because are you having a conversation with somebody who's readily acknowledging that they have a problem and want help? Or are you confronting someone that you're worried about?
Mhm.
So, and again, I have to remind people that eating disorders are not just anorexia. I think when we use the term eating disorder, we think of people who are emaciated. People who have anorexia don't just look like skeletons. That's not what they all look like.
Uh,
Many of them sort of ride at just slightly too low of a weight. They have to work very hard to maintain that weight, but their eating is very disordered. They're malnourished. Not everybody is capable of getting themselves to look skeletal, and most people with anorexia do not set out to look that way. But the longer you have the eating disorder, the more malnourished you become, the more rigid your thinking becomes, the more compromised you become cognitively, and it becomes harder and harder and harder to break the patterns that the eating disorder has set out for you. And so at a certain point, it becomes almost impossible to stop restricting, that there are certain biological processes that take place even in the brain that actually at some point, when your weight gets very low, it promotes itself. And so it becomes like a self-promoting disorder, and it becomes very, very difficult to stop doing it. In that sense, it has some overlap with addiction, that
uh,
you might start off drinking casually, maybe having some episodes of over drinking, and then there comes a point where you can't control it anymore. You might understand that your drinking is a problem, but you can't stop doing it. And I think a lot of times people, when you analogize an eating disorder to something like alcoholism or drug use, people get it.
yeah.
That there's something that happens chemically in the brain where you can't stop doing it on your own, even if you want to. And people with eating disorders are in a bind because there is this high drive for thinness. And so even though they may want to be better, they understand that psychologically they're not faring very well. They're so afraid of the weight gain, and that's a pathological fear. I mean, I think anybody can say, well, of course nobody wants to be fat, but that's not what we're talking about. We're talking about a misperception of what their body looks like and a misperception of what is an appropriate weight for them. So their thinking becomes very irrational and very distorted, and it's very hard for them to make good decisions about how to care for themselves at a certain point. So when you talk about how do you have a conversation with someone, first of all, I think if you're really concerned about somebody, you have to risk the possibility that you might say the wrong thing. But if your heart is in the right place, and you know that this person isn't well, maybe you've caught them engaging in behavior, maybe you caught them purging,
Mhm.
Maybe you're noticing that the way they're eating is very odd. They're not eating when everyone else around them is. Maybe they're avoiding going out to dinners with friends. Maybe they're bringing their own food. Maybe they're sitting at a dinner and not eating at all. Or they have a very limited range of foods that they're willing to eat. And this is just sort of tweaking you. You see it, you don't totally understand it, but you recognize that it's weird, it's odd, and it's changing the way your friend or your loved one is interacting with you. They seem maybe more withdrawn. They're wearing baggier clothes. They're complaining a lot about being unattractive. And yet it doesn't look that way to anyone else. So if you're seeing that they're looking pale, their hair is falling out, they're not going out as much, they're not smiling as much, they seem very preoccupied with their weight or with the way that they're eating. I mean, these are all things that can interfere with relationships. So I do think that if you really are worried and you don't know whether or not this person's getting help, or if anyone around them really knows what's going on, the person could have a bad reaction, because the eating disorder thrives in secrecy. Even though they're very focused on changing their bodies, a lot of the behaviors are done in secret. They don't want people around them seeing what they're doing. There's a lot of shame
Yeah.
around what they're doing. And so if you call that person out, they may have a negative reaction. And so that's the eating disorder getting mad at you, not your friend, not your loved one. And recognizing that if your heart's in the right place and you go with an open heart, seeking to learn and to listen, but to also share that, look, this just doesn't feel right to me. This doesn't feel normal. And I think you need help. Once it's out there, it's out there. And you can't take it back. And then you know that at least someone has told that person that what is going on with you is not okay. And I'm worried for you. And so maybe that day they're angry about it, but maybe down the road, someone else will say it and they'll say, wow, now 2 people have said that to me. Now 3 people. Oh, my parents have been saying that to me for the last 2 months. And now my friends are saying it. And so it's worth taking that risk. And I know it's hard because it's not pleasant to have someone that you care about get angry at you or start a fight with you. But in the long run, you're speaking to the healthy part of that person. And that healthy part of that person may not have much of a voice in that moment. But at some point, that healthy part of that person will recognize that what you said was caring and helpful.
So it seems as though with what you said, it's almost necessary to do a little bit of confrontation. And I've heard this from Tony Robbins. I know, and he said, you know, you're only you're as successful as many uncomfortable conversations that you have. And in a sense, this is overly simplifying the severity of what we're talking about. But also, when you described the similarities with addiction to alcohol or drugs, that really cleared it up for me. Because it's almost like one of those things that you just deal with the rest of your life, and you have to always, like, there's Alcoholics Anonymous, there's Gamblers Anonymous, there's Drugs and Narcotics Anonymous, and all these people just get together and they have sponsors. Is there a similar community like that, or is it just too new right now?
Yeah, I mean the 12-step world, like what you're describing, AA, NA, there are people that do find that world helpful. A lot of times they have also struggled with other addictive behaviors, and so the 12-step model works for them. And so I try not to judge. I will say mainstream eating disorder treatment does not typically embrace the 12-step model for recovery.
So it's not like that, but just kind of in high level, that's the way that we could think of it in a sense, not the details though.
I think in terms of dieting, because we live in a culture that is constantly promoting dieting. And so there's always some fad about what is the best way to eat, what is the quickest way to lose weight and keep it off. And there is all this mythology around how great your life is going to be if you're able to diet and make your body conform to an ideal that is not realistic for the vast majority of people.
Right,
And
right.
so, right, everybody thinks they should be able to attain the body of a supermodel. But if that were the case, everybody would be a supermodel, right? Like, that's not how everyone is built. And even supermodels aren't built like supermodels. And there's been plenty of women who have come out saying that they just couldn't continue to live that way, that they were killing themselves to look the way they looked. And so we as a culture, we as a society have bought into the notion that everybody has to be very thin or have a very fit physique, and that there's a right way to look and a wrong way to look. And if you don't look that way, if your body does not conform to these ideals, you get judged negatively. And people will say things like, if you're not happy with your body, just go on a diet. Well, that might help for a little bit of it, but you may also just have a curvier body. You may just have a body that's not going to look like that. And so how can we achieve body acceptance? How can we achieve optimum health? And start to live in a world where we accept that people's bodies look all different ways. And a lot of people will cloak body shaming language in health language, like, oh, I'm just really worried about your health. I don't want you to get diabetes. And that, look, there may be situations where that's true, but there's many situations when it's not true.
Unless a doctor tells you. I mean, no person, right. No friend is going to be able to even assess that.
And someone can be in a larger body and be perfectly healthy. They can be active. They can live a very full, active life. They may just have a larger body. At the same time, doctors and family members do this a lot. They say, look, your weight is really a concern for me. You don't exercise. I'm not comfortable with the way you're eating. I am really worried about your health. And those may be legitimate concerns, but if you've said this now more than once and the person's not able to change it, then maybe what we're dealing with is someone who has a disordered relationship with food. Maybe, right? And so by telling the person that it's as easy as just going on a diet or just eat a few more salads, or why do you eat that? That becomes more shaming, right? And then what happens is the person retreats into more isolation, and the behaviors can become more disordered. So these are very nuanced issues, but in general, I really wish people would stop giving each other advice about how to lose weight or comments on how someone should lose weight. I just don't think it's helpful. It's really just buying into this narrative that everybody has to have a certain physique. A, not everybody wants that physique. B, not everybody is going to be able to attain that physique no matter how hard they try. That's one of the ways they get into eating disorders. And maybe we would be better off if we could accept that people's bodies come in all shapes and sizes, and that's beautiful. That's wonderful. And what matters is that you live a healthy, productive, connected life where you have meaning and purpose in your life, and that we're not judging people based on how they look on the outside. And when we go back to that influencer that you interviewed, that's what I thought about. Is that this was a girl who really was caught between two different pressures. She really was trying in certain ways to express an authentic part of herself, but also put herself out there on social media as an influencer, where she was the recipient of a lot of scrutiny. And, it's a lot of pictures of herself of kind of, look how pretty I am. Look how cute I look in this outfit. Look at me working out. And so on the one hand, I think she had a real desire to be helpful to people. And I think she really wanted to use her platform to do something good for people and to maybe help people who were struggling with the same kinds of insecurities and feelings that she had. But then on the other hand, she was living in this world of social media influencer, which is about as superficial as you can get, right? And trying to make a living that way, trying to get more followers. And that's an unreal world too. And so it seems like she really struggled, without knowing her at all. She struggled to balance that, unfortunately.
Yeah, it seems like that's a very good observation, because you could tell, like, she did talk about it openly. It seems as though at least from the comments I've seen, like, the fact that she even talks about her mental illness, let alone, is a very shocking thing to her community. And her followers are just, very much heartbroken when this happened.
Of
because you would
course.
think that she was getting better because she seemed like she wanted to, but at the same time, it just kind of took her by.
You know,
Um,
the thing I don't know about her situation is the degree to which she received treatment.
yeah, it doesn't
Uh,
seem like she did, but I don't know.
yeah,
She
so
just
so I
traveled.
don't know. Yeah, I mean, which is really unfortunate because here she was laying it all out for people, and maybe she was getting treatment, but she was laying it all out for people and talking about it, and I think probably really hoping that someone would connect with her in a way that would be helpful.
Like help.
Right. But at the same time, you're under tremendous scrutiny when you are an influencer, right? I mean, that's a very appearance driven world.
Yeah, definitely.
So
And
it's not an environment to recover in,
yeah,
truthfully.
so you kind of need a place where you can be with positive influences and you can also reinforce your self-esteem, reinforce the way that you look at yourself, and almost like a radical self-acceptance in a sense, like a
Absolutely. Absolutely. Yep. Hmm. Right. And sometimes that means taking a break from social media. Sometimes that means taking a break from school or from your job. Or if you have a particular hobby or profession that is extremely appearance based, you might need to take a break from that for a little while in order to get well.
do you think that psychedelic therapy, you know, with the rise of its effectiveness in treating PTSD, depression, and anxiety, whether it be ketamine or psilocybin mushrooms, or do you think that these have the potential, or do you know if they've been tested or anything to treat mental illnesses as complex like eating disorders?
I have not yet seen that. You know, the ketamine is available. There are places that you can go and get ketamine treatment. It really is used right now. My understanding is for mood disorders, primarily just for depression. I don't believe that it's even really being used for bipolar at this point. Um, I have worked with someone who had an eating disorder who had really resistant depression. And so she was given ketamine as a way of treating her depression because the depression was a part of the engine of the eating disorder. And so the thinking was if we could get the depression under better control, the eating disorder might also get better. So in that sense, that someone may also have PTSD or very traumatic experiences that they haven't been able to work through and resolve. Um, if they are healthy enough at a certain point, I could see psychedelics being used, but I don't know that right now. I haven't seen any research on that because, like psilocybin, that isn't even something that's FDA approved yet. So, so like ketamine is FDA approved. I'm sure down the road we will see more studies using it in other populations outside of depression. And so that's just a matter of time to see what's safe and what's not. But of course, for people with eating disorders, they often are medically compromised. So we always have to consider the medical piece first, wait till they are healthier before we would consider some other treatment like that.
That does make sense. It'd be interesting to see if it does have any effect, any hopefully positive more than negative. And if you could leave our listeners with, you know, maybe just a few last words, what would you, anybody who they may know who has anorexia or wants to get more educated on, or just completely did not know about anything about anorexia nervosa, or just in general about life, like what would you like to say?
Okay, well, that's a big question. Well, I would say, look, if you feel that you or someone you know is struggling with an eating disorder, there are a number of resources available online. The National Eating Disorders Association has a good website. There's also the International Association of Eating Disorders Professionals, and those are places where you can get referrals. There's something called edreferral.com where you can get help for your eating disorder. There's an organization in Palm Beach called the Alliance for Eating Disorders Awareness. They offer free groups and low-cost services. And there's a number of residential treatment centers around the country and in the state of Florida that accept insurance. You can always call your insurance to find a residential treatment center. But if you go online and you Google even anorexia nervosa psychologist near me. You will find people who specialize in this. And so
Yep.
it really is a specialty. I really, really recommend that if you are going to seek treatment for any kind of eating disorder, right? It's not just anorexia that is a problem. There's bulimia, there's binge eating disorder, and there's a number of other types of eating disorders and disordered eating that are really problematic for people and that can be very dangerous. But finding people that really have experience in treating these conditions is really, really important. Like I always say, you wouldn't go to a gynecologist to treat your cancer,
Yeah.
right? You would see an oncologist. So, and so really finding someone who knows how to handle this. Oftentimes people with an eating disorder need more than just a therapist or a psychologist. They may also need to work with an eating disorders nutritionist, a physician, a psychiatrist. So oftentimes we wind up assembling a team of people for someone who has an eating disorder to help them get well. If they cannot get well out in the community with a team like that, then we talk about referring them to a higher level of care where they can get more intensive support and supervision. They might have to stay there for a month or two to stabilize and really kind of learn how to eat again.
Thank you very much, Dr. Amy Boyers, for being on the show and educating myself and anyone who's listening, and just to be more informed on eating disorders in general. We did focus on anorexia nervosa, but it seems like it could be a wide range of things that might look like anorexia nervosa. It's just eating disorder. There's a big blanket there or umbrella there. So I'm going to stop the recording here, and thank you very much for being on the show.
You're most welcome. Thank you.